Good evening. I'd like to welcome everyone this evening. Before we stand for our invocation and pledge, I just ask everyone to keep Commissioner Fleming in thoughts and prayers. He's out with this virus. I spoke with him late yesterday afternoon. He's in good spirits. He's feeling pretty good, just really tired, congested. But so far, so good with him. I just look forward to him getting back with us, and trust me, he wants to be here. He hates being at home, and he likes being a part of this county and helping all of us do the right thing. So if we'll please stand now for our invocation. Dear Lord, we just come before you tonight to do the business of the county. We ask you in this new year to please give us guidance and wisdom. We ask you to please be with those who's sick and ill at this time. We have county staff that's out with other health issues that has nothing to do with COVID. We ask you to please be with them. I ask you to please be with Commissioner Fleming and some other county staff that has COVID. Just please watch over them and help them get back healthy, help them get back to us and help us lead this county in a positive way. In Christ's name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Speaking of COVID, I've asked Mr. Terry Walden to come up this evening, and he's going to give us an update. We'll get into our actual minutes and rest of our meeting. Welcome, Mr. Walden.
Thank you, Chairman and Commissioners. I appreciate the opportunity. We've had an awesome day at the Health Department today. Today was our first day of doing full vaccination, and I'll go into the report here in just a minute to give you the numbers and details. Currently, we have 4,213 total cases since March the 26th when we had our first case. Over the last 14 days, we've been averaging 35 cases per day. Over the past 7 days, we've averaged 38 cases per day. And if you'll recall, several months ago, we went from 7 cases a day to 10 cases a day to 21 cases a day, and now we're averaging in the 30 cases per day. So there's certainly an increase in our cases that we're seeing in Suwannee County. Cases that have recovered to date are 3,904, which means we've got around 309 active cases. We have received 1,000 doses of Moderna, which is the COVID vaccine. The COVID vaccine is a 2-series shot. You receive 1 shot, and then 28 days later, you'll receive your second shot. Based upon the governor's executive order, our target populations will be those individuals 65 and older and healthcare workers with direct patient contact. It is not subject or open or available to the general public yet at this time. But once we work through those populations, we feel confident the governor will allow us to then begin doing an open vaccination. The long-term care facilities and nursing homes are being vaccinated, but that's through a federal program with CVS and Walgreens. To date, we've had 143 people vaccinated in Suwannee counties, and that's through the doctor's offices, the hospitals, and the health department. Today we began our full open vaccination to those that have made an appointment, and we vaccinated 120 people today, which was thrilling and wonderful because we had anticipated only doing 50. We were able to streamline the process, open up a lot more appointments, and we were able to call those folks that were on the waiting list to get them in sooner. And believe it or not, people held to their appointment time. If it was 9:15, they got there at 9:14. So it worked out well. We were able to smoothly go through that. If you want to receive the vaccine, you are 65 and older, you can call the health department, get on our list. We will schedule you an appointment. We met today with the emergency management folks, fire and rescue. We are trying to plan a drive-through clinic where we can do a mass vaccination by appointment only of about 400 people. We have these doses of vaccine, and we're wanting to get them out as expeditiously as possible. The governor's office and the Department of Health wants us to move expeditiously, so we're looking at a lot of different ways that we can accommodate folks in a very timely, quick fashion. Some of our services at the health department next week will be suspended, but we are not doing any COVID testing at the moment because the staff that does the COVID testing is also the staff that does the vaccinations. So we're having to prioritize, and we're trying to not let the vaccine sit in our refrigerator more than 7 hours. And it's a tricky math formula in that the vaccine, that you have to thaw it out, and then you can thaw it, take it from the freezer and thaw it in the refrigerator for 2.5 hours, and then you can move it into vaccination 15 minutes later, or you can set it out on the counter and let it thaw out for an hour, and then you can start vaccinating. If that vaccine ever thaws out, you've got 12 hours to vaccinate, to use it up. If you ever puncture it and use one of the dosage out of there, then you've got 6 hours in which to continue the vaccination. So we've got to be very methodical in how we do this, and that's why we're doing it by appointments, because I don't want to come up and have 4 vaccines left and nobody else to vaccinate. So we're very, very conscientious of that. And today we were able to, get a hold of some people and make sure that we do not waste a dose. And the vials are there's 10 doses per vial. And so that'll just give you an idea of how we're calculating as we move forward. We are going to vaccinate again Thursday here, and we are already calling those individuals. And we expect to do the same number on Tuesday that we did today, if not a little bit more. So our staff is working extremely hard, and we're very, very excited. We're hoping to have a clinic on Saturday that'll be drive-through by appointment only. We're finalizing those details and working those details out now.
I got a question for you, Mr. Walden, I
Sure.
didn't mean to interrupt. Are you doing those at the health department now? Is that where the appointments are?
Currently call the health department, and the vaccinations are taking place at the health department.
After the fact, when you try to move into mass vaccinations, you're gonna do a drive-through is what you hope to do at some point?
We hope to do a drive-through at the Coliseum.
At the
because
Coliseum. My question to that is, you just see some craziness on TV about people not acting like they're supposed to act, and you have to start lining up and doing things. I just want to make sure you have all the support you need when that time comes. I mean, if we need our sheriff's department to help out in any way to keep the peace, and I just don't want you to be overran with people, is what I'm saying.
Well, and we met today, and Ms. Joyce met with us, and Eddie Ham, because there's some other particulars. This vaccine is different. Once you give the vaccine, someone has to wait 15 minutes for observation to make sure they do not have an allergic reaction to the vaccine. And so there's several stages you go through. You go through the screening process where you fill out your consent form, and it goes very easy. Just ask a series of questions. And some of the things are, you got to be 18 years of age or older. But in our case, we're focused on the 65 plus population. You can't have had COVID within the last 14 days. You can't currently be sick. So there's a screening process that we go through. Then once they move through that screening process, they go to the nurses where they review the information, they give the vaccination, then we place them in a holding pattern for 15 minutes to make observation to make sure there's no issues. And today, no one had any issues whatsoever. So, but it is a process, and when you're going from 120 to trying to do 400 in a day, that's a huge number. But it will be by appointment only. We will not be advertising that it's a cattle call.
I got you.
We'll call folks, notify folks where to be, what time to be there, and that we'll have support from law enforcement, from medical staff. We'll probably use some of our folks from River Oak Tech, the nursing students who can get credit for participating. They can help us monitor and manage the folks that are waiting there for 15 minutes. So it'll be a pretty big operation that we're working on trying to pull that off.
It sounds like you're already covering most of your bases. I just want you to know, and I think this board feels the same, if we have any county resources that we can help you with, please don't hesitate to ask us. I mean, if it's fire rescue, whoever it is, I mean, we'll reach out and do whatever we can.
Thank you,
totally
I
believe
appreciate
it's
it. And once we get it going, if it's successful and we feel like we need to do some more, then we'll certainly reach out to the parties, our partners, and try to do that again. We just, if we're getting the vaccine, we just want to do our dead level best to get it in the arms of those folks that desperately need it or that are wanting it. So I can tell you right now, our list is about 950 strong. When we received our first dose, I thought, well, we won't be able to get rid of 500 vaccines, and we'll have all of this vaccine gone very quickly, I feel like, based upon the calls that we're getting.
How do you get more?
Well, the state usually tells you on a Saturday or Sunday that Monday you're getting a delivery. And then we've got 7 days in which they're wanting us to push it out in 7 days. So And that's on top of us doing our other services. So some things will have to go lacking a little bit so that we can focus on and prioritize. It's challenging, but I've got a wonderful staff. We've been meeting constantly, talking about ways to do it. And today, we started out thinking we could only do 50. We saw very quickly we could open up some more slots. We opened those slots up, we called people, and they came. And so we're already preparing and planning on Thursday to have more slots, to have more people so that we can make a huge dent in getting our community inoculated. We did have calls from Duval County wanting to come over and get vaccinated or put on our list. We cannot tell them no. The governor has issued that no matter where you're from, what county, what state, that you are eligible. I will tell you that those folks that are from Suwannee County, and I also oversee Lafayette County, will have a priority. So we're going to prioritize and make sure our folks get the vaccine. We will put you on the list if you're from another county, but we're going to look after our folks first. And as we go through the list, and if you still want the vaccine, we'll get that to you. But they had such long lines in Duval County. I think some folks were trying to circumvent the process.
Well, that's what I'm afraid that we may get into here. That's why I just want you to have the support of anything that we can do for you, whether it's, traffic monitoring with the sheriff helping out if we need to be, or whatever. I want it to be smooth, and I don't.
We do too, and we've got a process in place that there will be a confirmation number they'll have to provide. If you don't have that confirmation number, the only way you will be able to get that confirmation number is through the health department, and we call and give you your appointment. And if you can't tell us that confirmation number, then you won't be able to get your vaccination number.
Before I let you go, do I have any more questions from the board? Anybody have a question for me?
Mr. Chairman, I've got a question.
Yes, sir.
And Gary, if you already covered this, I apologize. I was trying to fix a memo here. Is this vaccination also being made available to people who have already had the virus? Or is this only being offered to people who have not had the virus as of yet?
If you've had the virus within the past 14 days, you cannot take the vaccine. If you've had the virus outside of the 14 days, you are eligible to take the vaccine. So according to the medical review and the information on the virus, they do state if you've already had the virus, you can receive the vaccine, but it would help ward it off with you contracting the virus again, because we have seen you can contract the virus again after about 90 days, and you would be infectious again. If you contract the virus within the 90-day window, you are not infectious. Now, this new strand that's out there that we're seeing, it has come to the United States. We're uncertain whether this vaccine, how effective this vaccine will be against this new strain, because this is a new vaccine. It's only been in trials for less than 9 months average. But all the information that we have is that if you've had COVID before, and you're outside the 14-day window, you can take the vaccine. It's safe to take the vaccine.
Before I let you go, is there anyone from the public that has a question that hasn't been answered? If you would, just please come to the podium. Or you can go ahead and say it from there. We're trying to keep distance. Mr. Snowden, just state your name.
Wendell Snowden, Wellborn. Just wondering how much warning time do you give the people that you're calling that are on the list?
I'll repeat the question for the audience. How much warning time are we giving folks on the list? We got the vaccine started last week. We opened it up for people to call in. Right now, we're trying to give you at least 48 hours notice. Some today did not, they were on the list last week. We called them and we were able to open up more slots, and they had maybe just a couple of hours. That's not our intent, but today, once we open the vial, we don't want to waste it. Right. And everyone, there were some we didn't reach today that were on the list. We'll go back and call them again. There were some that says, I'm sorry, I'm out of town, I can't make it. We'll put them back on the list, but we don't want that to be the norm, but it did work today. We saw we had an opportunity, and we wanted to try to get as many people vaccinated as possible.
But you don't call us and say, we want you there in 2 hours.
No, sir. We'll call you. You will get noticed in advance.
Okay.
The only way you would get called the day of is if we see we cannot use up a vial, then we're going to try and get anybody we can possibly get in there so that we get 10 doses out of that vial. because we do not want to waste any of the vaccine.
Any other questions for Mr. Walker?
Robert Ford, and not a question, it's a comment. I put my name on the list last week, and I went to Gainesville to a doctor appointment today. When I got home, I had a message on the machine that had I been home, I could have came in today to take my shot today. But as it is, I have an appointment for 9 o'clock Thursday morning. I'm looking forward to it. I just want to commend them for this service.
Thank you, Mr. Ford.
I have one more question in the back.
Sorry.
Mr. Baker.
It's all right, Kerry. I was just going to ask, if you had the virus and you were given an antibiotic, are you still, is it whether you still have an immunity for the 90 days, or does the antibiotic kill the virus inside so that there is no immunity?
I am not a medical professional, don't profess to be, and if I could answer that question, I probably wouldn't be working at the health department, but I would be at the CDC. I don't mean to be funny, but there's a lot of unknowns still with the antibodies. If you have it, we're seeing folks that do have the antibodies that have tested, and we're seeing folks, normally if you're within the 90-day window and you can test positive again, you're not infectious. They're saying outside of that 90-day window, you can become infectious even if you do have the antibodies. There's still a lot unknown about this virus. I was able to receive the vaccination because of the nature of our job and the folks that we're around. I had no side effects. I got prettier, so I think that's all I had was, shot in the arm, didn't feel it, didn't have any bad side effects. And all the folks that we saw today, 65 and older, they actually cooperated and listened and sat around for 15 minutes while we observed. No issues whatsoever. So at first I was not going to take the shot after seeing our increase in our cases in our community and knowing our responsibility at the health department. I felt like that it was the right thing to do, and I'm glad I did. And 28 days from last Wednesday, I'll be getting the second dose. But you got to get the second dose. We're not sure how effective just the first dose will be without having the second dose. And just so you'll know the operation, everybody that we're vaccinating, they're getting a card, a reappointment time. They've got to come back on that 28 days. There is a window of 4 days that you can miss or to make it, but you really are trying to keep it to where you'll come back on your 28th day. Because 28 days from today, we're going to vaccinate 120 people.
I have a young lady who had a question.
He answered the question.
He did? Okay, thank you so
Thank
much.
you,
Does
Eric.
anyone else have a question? Thank you. Yes, sir.
Can I talk? My name's Hank Smith. I hope y'all don't get mad at me for this, but is there a protocol in place if this thing starts to damage people? Like, has anyone even thought that through? Like, are we just giving shots to people as, the old saying, the solution shouldn't be worse than the problem? So is there a protocol in place for you to go get this vaccine and it starts to damage you a year, 2 years down the road? Like, what's in place for that?
Well, this shot is strictly voluntary.
Okay.
When you sign a consent form, you're signing that you understand it is not a fail-proof vaccine. And there are some personal accountability that if you do get sick down the road, then I would you need to seek medical treatment from your primary care physician. But right now, we give you the Privacy Right Act of how we'll treat your information, and we also give you the information on the Moderna vaccine, what you can expect, what the good is, what the bad is, what it will or won't do, and it's about 22 pages that you can read and research. So when you do take the vaccine, you are fully made aware of all the current information that there is. So then it becomes a personal choice on whether you want to take the vaccine or not.
I appreciate you coming in this evening, Mr. Walden. I will say he takes his job very serious, because I reached out to him this morning to see if we could get an update, and he informed me that they had vaccines and he wasn't sure he'd be here, that he was working. So I'm grateful for that. But I do want to say I appreciate you coming in and sharing. I mean, it was very informative, I think, for everybody that had a question. I learned a lot in 10 minutes more than I learned in 2 months listening to TV.
I promised you 5, and I'm sorry to take 10. But I do appreciate y'all's support of the health department, our team. You know, this is, we've had the H1N1 flu vaccine stuff before. This is a little different because we're focused on certain populations, and the process that you go through is a little different. But I've got a great team. If you do call the health department to get on the list, please be patient. Our phone system went down Monday because of the volume of calls. But we're working as hard as we can, and we're trying to update our website to produce some additional information. Be patient with us. We do have enough vaccine for all of those that want to get vaccinated, and we will be getting the second dose. We're not going to hold back any vaccine. If we've got 1,000 doses, we're going to give 1,000 doses. We have been confirmed through the federal government to the state that we will get the second round of vaccines, and we're not holding back any vaccines. And we're going to do our dead level best to get all those that want it vaccinated.
Mr. Chairman?
Yes, sir.
Did you just get 1,000 doses? That was it?
We got a 500 dose, and then we got another 500 doses.
And so do you have to give all that and then you get more? How does that work?
Well, we're having to report daily on the amount of vaccines that we've given, so they are monitoring that to see, then they'll start pushing it out. The fun part with the state is we may not know till Saturday that we're going to get a shipment on Monday.
I got you. Thank you.
But I do know that the FQHCs, which is ours here is Palm Medical, they are receiving vaccine to vaccinate their staff first, and then to start vaccinating their 65 and older patients. Some of our nursing homes locally have received the vaccine. Some of our doctors' offices are getting the vaccine, so they'll.
So there's going to be more than this.
There will
All
be
of them
more.
relying on you. I mean, there's going to be more.
Correct. We won't be the only game in town, and we can't be. We need help if we're wanting to do it in an expeditious, quicker manner.
Well,
Mr. Musker don't have a mic over here, but he did point something out when you said that you didn't have any side effects other than looking better. I heard him say, so your eyes are going bad.
We appreciate you, Mr. Walden. You're excused. Go get you some rest. I know you got a big day tomorrow.
Yeah, we'll be in Lafayette tomorrow doing the same thing. So I have the pleasure of being over both counties, and so we're going to treat them with the same respect we give our folks here. So thank you.
Thank
Thank you so much. Have a good evening. Appreciate everybody's patience. I just really wanted to get an update and kind of had some questions that we need to get answered, and I feel like we got some answers to some of those things. And I think it's part of our responsibility as leaders of the county to be able to, when we have people call and ask us questions, you know, try to, for us to have some answers for them, hopefully, or at least point them in the right direction. So I was grateful to get an update, and that means a lot with what he's got going there and the undertaking they're doing. Our first item this evening is approval of minutes from our December 15th, December 17th, December 22nd, and December 29th meeting. Have any questions or comments, or do I have a motion to approve?
Mr. Chairman, on the December 29th meeting, there's a minor typographical error. It's got your name instead of Don Hill's.
Fair enough. Will that correction be stated? Do I have a motion?
So,
Have a motion by Commissioner Lamb, second by Commissioner White. All in favor say aye.
Aye.
All opposed, same sign. Motion carries. Moving ahead to the consent agenda, I have items 2 through 10. Do I have any questions or comments, or do I have a motion to approve? I think our items, just to clarify, I said items 2 through 10, but on some documents that was on the counter, it's 2 through 9.
Yeah.
I just don't want to, I don't really know what the,
Which one are they missing?
well, that's what I don't really understand. without-
I got 2-1. There's 2-1.
Okay, all right. Thanks so much. I didn't want us to be talking about approving something that you couldn't see. Thank you for that, Ms. County. So with that being said, do I have a motion to approve?
So moved.
Motion by Commissioner Hill, second by Commissioner Lamb. All in favor say aye. Aye. All opposed, same sign. Motion carries. Thank you, gentlemen. Moving right along, before we get into general business discussions, I will say that item number 15 has been pulled. It will be brought back at a later date. And now we'll back up to item number 11. Discuss items for legislative delegation. Mr. Harris.
Chairman, Commissioners, I've mentioned this before. I would emphasize that while in many years, most years, many counties will make requests for state appropriations for any number of local projects. We're all very much aware that funding can be off, revenues can be off with the state because of the virus. So I don't know that a request for state appropriations is going to actually get fulfilled this time around. But having said that, I did comment previously that if the board agrees that we need to begin requesting funding for improvements for our ag complex, what we've been calling the Coliseum, but I think most of us are aware that we can use a covered enclosed building with stalls in it. And that might be a first step. I've seen it occur in other communities. Sometimes it takes a number of years in order to get the funding approved. But if the board wants to pursue that, we can put that on a list. Another thing that I believe I've talked to all of the commissioners about is the possibility of getting the legislature to change the statute on local state of emergency renewal. I think everyone in the state's probably going to be making that request, and it might be a good idea for us to do the same. So those are two items that I can think of readily that you might want to consider, and then anything else the board wants to consider, we can put on a list. We typically type a list, put it in their hands. The chairman makes the presentation typically, but when they leave, they've got something with our letterhead on it saying this is what Suwannee County is requesting, because they serve in multiple counties, and they're going to have their own list from other counties as well.
I personally am very in support of trying to do something at the Coliseum in the future. I know it's years out for getting funding, but there could be so many more events in Suwannee County if they had stalls, which is housing for overnight events where they can keep their horses, or it don't matter if it's cows, it don't matter goats, it doesn't matter what it is. I mean, if it's a weekend show, it doesn't even matter if it's a car show for that fact. I mean, if you got a place, a nice place, I just think there's room for improvement there, and we could do it if we had the funds, but it's no different than anything else. You got to get in line.
I think that's a good idea. I've had several folks in the community from all of our districts say they'd be willing to contribute financially if we could muster up some funds. You know, I don't know how much that means, but at least that's a start in the right direction.
And RV hookups, I think we had mentioned that in one of the meetings. That's a big deal. I know when they had the Little Britches event out there, we had 200 we could have hooked up to.
Well, and that goes hand in hand with the stalls and,
Yeah.
the RV hookups. I mean, that's,
Yeah.
it's all of the above. And, so I feel like the board's has a consensus on that. Is there anything else that any one of you would like to have added to the list? I mean, it's, yes, sir.
I forgot to mention, I did mention this previously, we need to make requests in lots of different areas for this type of funding, the funding to build a hardened EOC building. Clearly, we don't want to have to try to fund that, but FEMA, CDBG, any number of agencies out there might offer funding for that purpose. Specifically, the state hasn't been offering funding for quite some time on that. You know, it comes and goes. But that's one thing that we could add to our list and at least get it on the radar with hopes that someday it might occur. And again, don't be surprised if it takes multiple years before they have an opportunity to say, yes, we're going to go ahead and fund this, or we'll fund it at this level, or something of that nature.
I mean, I'm perfectly fine and supportive of doing that. I mean, we've talked about that for years, and even when we see the funding coming, it's still going to be years out of planning ahead to do something. So it's not like you're saying this is exactly what we're going to do or where we're going to put it at this time. You're just trying to get some funds coming. A lot of times it's the next board that actually handles the funds. I mean, trying to weigh the time frames work.
Especially during these times, because funding is going to be hard.
It's going to be like the faucets cut off. I mean, it's going to be
That's right.
real. You know,
That's right.
it's gonna be tough sledding. So if everyone's in consensus with that, have those two things on the list.
3 things.
And the state of emergency.
Coliseum, the renewal declaration. and-
Yeah.
Yes, correct. You good with that, Mr. Harris?
I've got it.
All right. Thank you, sir. Moving ahead to item number 12, discuss with possible board action diversion of yard waste for composting. Mr. Harris.
Mr. Chairman, Commissioners, I just want to make some general comments and see if the board will concur. And then we can come back with something more formal later if the board chooses to do so. But I think across the country right now, everyone's working on trying to reduce the amount of waste that's going to landfills. In our particular case, can you hear me okay? Is this thing working? Specifically, I want to talk about yard waste, though. I've been contacted by someone who's got a pretty large farming operation. They visited with me a few months ago about composting. After that conversation, they came back later with some more refined ideas on creating composting for their farming operation. And they wanted to know if we were interested in diverting some of our yard waste that we pick up at our collection sites to their farm where they can turn it into compost for production of food. I told them I'd have to talk to the board about it. The primary concern I had was the cost of transportation. We don't want to pick waste up on one side of the county, drive it all the way to the other just to drop it off. Because what we do with yard waste is take it to the landfill. We have an air curtain and we burn it. If someone can use it, that's wonderful. But more importantly, if they can use it somewhere between the place that we pick it up and reducing the amount of distance we have to travel to drop it off at landfill, that's even better. So I want to bring that to your attention and see if there's an interest by the board to reduce the amount of some of the waste that's going, that we're handling with yard waste going to landfill and trying to burn it. Because it costs money out there, even though we've got a burner, we've got to have someone monitor that, push it up, and there's a lot of expense and time associated with it. If you have an interest in doing that, then we would put an agreement together and bring it back to the board for consideration. But right now, I know that we have an interested party, and there may be others in the community as well that would have an interest that we just haven't heard from yet.
I would just ask for input from the board. I think each commissioner, I'd like to hear what your thoughts are. We just go start with that.
All right, I'll go first. No, I'm not wrong with it. I think that it can save us some transportation fuel, miles on our equipment, and it's I don't know, I'm sure Mr. Harris, I think I know where this place is at, so, I mean, I think it's kind of the central west side of the county. Come up with a radius or plan that so many miles away from there, we don't go all the way to Langville, we just go there with the yard trash that he wants.
Yeah, in this particular case, I think it would be on the way back to the landfill, but we could make a stop. We're actually talking about source reduction. That's the big push that you've been hearing about, the Association of Counties and all the government magazines, the source reduction. That's what this would be.
I don't have a problem with it, we're helping a local
Yeah.
landowner, farmer.
Yeah, I think it's smarter to do that than to burn it, you know.
I guess one of the questions I got, and trust me, I mean, I'm in support of it. It is, and I don't know if this would be the person that's hauling the trash, but it would have to be a certain size. I mean, it would have to be very small stuff unless they have a grinder or.
Well, I already discussed that because we're not going to be in the business of sorting.
Right.
You see what I'm
So
saying?
you asked the first question that I got into, and this person has indicated they will handle it because there is larger debris on occasion. Not as large as what we produce with roadside cutting down big trees typically.
Right.
Because what you see most of the time that's going into our collection sites is much smaller than that. But we're not going to be sorting this yard waste for anyone, because that's too time consuming, and they understood that, said they can handle that. But we'll address that in an agreement that we can bring back to the board and make sure that we cover everything that needs to be covered.
I would also just make sure that Mr. Rabat covers us on the liability side for any accidents or whatnot that may occur with our employees on their property while we're boards of America, and make sure we're covering the liability side. Over there.
Oh, I'm all in favor of it. As a matter of fact, if you wanna dump something at my place, you can, so. I'm good with it.
I think I would kind of, I don't know if I want to just go with a blanket long-term program. I don't know if I would mind just maybe doing a year or something, maybe sometime.
Trial.
And just maybe getting some response, feedback from county administrator or whatever, and then it's going good. I just,
Well, as most of you know, I own a nursery, so something like that would fit right into making my potting soil that I use on my nursery. So that's why I said we could just dump it at my place too. So my thinking is if it works and you had 3 or 4 people around the county that wanted it in different areas, then you wouldn't be going past somebody to go dump it somewhere else. You know, if we had multiple places to go with it, we could probably eliminate almost all of it.
recycling's where we need to be, there's no doubt. I mean, smoke going up in there is not good for
I'm
anybody.
sure that air curtain ain't cheap to run.
So, I think you got consensus to move forward.
We'll put an agreement together and bring it back for consideration.
Sounds good. Item number 13, discuss with possible board action radios for sheriff and fire rescue. Mr. Harris.
The sheriff really wanted me to change this, so it wasn't item number 13. Commissioners, we had an extensive meeting and conversation about this radio issue. I had not participated in these meetings previously on the radios, outside of what occurred here at the judicial annex when the board participated previously. But we had a conversation about the fire rescue's needs and the sheriff's department's needs, and everyone that participated in that meeting, I think, agrees now that we have 2 agencies that have different needs. Right now, I'm of the opinion that we need to satisfy the need of the sheriff's department separate and apart from fire rescue. Fire rescue, they've got different equipment needs, and their equipment works different than what law enforcement uses. And we had, over the last few years, investments have been made in some of the equipment technology that fire rescue does use. So we can continue what we've been doing with them and satisfy the need that they have. I would recommend that we come back later with that. For now, what I need to know is if the board is prepared. We actually had agreement with the previous commission to go ahead and start putting this information together and bring it back, but we've got 2 new commissioners now, so I wanted to ask the question. If we're ready to go ahead and try to put an agreement together. I've spoken to the representative, and I think we've got a representative here tonight, but I don't want to get us bogged down into the minutia of all the different moving parts right now. Generally, though, our conversation was that on the procurement side, that we would have to have either a state contract or government contract that we can piggyback on, or we would have to go to bid, providing that we can address that adequately and bring it back to the board. Is the board prepared to go ahead and give us instruction to bring an agreement back that complies with our procurement policies for board consideration?
I'm ready. I know I'm ready, but I'll ask for the board's input at this time. I mean, it's been a discussion ongoing for a long time. I mean, basically since I've come on the board, I know it's been talked about. Finally, we was getting real close, and then COVID just took us off the ball. But I mean, it's important. It's about safety, and we need it. So I ask the board to please consider us moving forward with this.
I don't have a problem getting information together and bring it back to us. Yeah, I agree with Commissioner Stapleton. I mean, it was going, I think, even before you come on board, we've been having these talks.
So,
I'm I'm good. I'm good with it. I agree. It's a safety issue. I talked to a sheriff in another county that had similar issues many years back, and he was in the tire business as well, like us, and he went to the slurs, and best thing since sliced bread. The service that area has picked up, and it's I think it's hard to put a price on anyone's life, and if one of our deputies is in a bind and it's a handheld you can't get out, then I hate to know that I was one of my kids or one, or anyone's, but I think it's time. The county's growing, got more calls, more demand. I'm in support of it.
Well, and also, I mean, it's kind of two-sided. I mean, it's for the safety of the officers, but I mean, it's for the safety of the community, of them getting there. I mean, if they can't get to you or they can't have radio contact, I mean, you're sitting there helpless. And I sure don't want that from anybody.
I'm good with it. I'd just like to see some more information.
Well, let's clarify, Mr. Harris. I want to know what you're thinking, where we're going. I mean, I want to order some radios. That's what I want to do. I want to figure out how do we get there. What's our next step? I don't want to leave this meeting and be unclear again. I want to,
My plan is to bring in,
I second that.
Mr. Chairman, my plan right now is to bring an agreement back to the board. You've got details, you've got all of the costs, and that we can check off the box that says that it complies with our procurement policy. That's the plan.
So
That's what I plan to bring back to you.
the next order of business is us seeing the numbers in front of us and we say yes or no.
The only potential impediment would be if we can't get satisfied that it complies with our procurement policy. That's the only thing that would interfere with that. And if that were the case, then I'd come back here and say, okay, we know what we need, we just need to go out for bid. But if we can avoid that by piggybacking on a contract that's already been competitively bid through the state or another local government, which your procurement policy provides for, then that will get us there quicker.
Mr. Chairman?
Yes, sir.
Is there currently a sheriff's association bid or anything we can piggyback on as a current?
Yeah, there's currently a state contract between Harris and the state for the state radio system. So there's a state contract in place for matters like this.
Please state your name and who you're with.
Josh Franklin, I was Wave Communications, sorry.
That's fine, thank you. Well, usually we have you come to the mic, but we're not gonna do that. Everybody talking into that got in trouble with Mr. Snowden. He got me straight on that, but I just need to get everybody's name for the record.
Yes, sir.
Sheriff, you got anything you'd like to add to this?
Yeah, well, Josh had brought us 4 radios, and myself, Sean, and Buddy, and Tom. We've covered every inch, not every inch, but, north, south, east, and west, and we have not found a dead spot in there with a handheld. And that's our biggest problem, is our handhelds that we have now, because you're just, you may get out and you may not, and we're all riding around in vehicles, inside the vehicles, and I was really impressed with it. And in 40 years, that's the first time I've ever talked on a handheld and get out here in Suwannee County. And it was just real impressive, and it's just, and you also, the biggest thing is the safety for all the officers, which I was talking to Commissioner Land yesterday, and I could just tell you example after example of when an officer get out of the car and they can't get back on the radio, and we don't know where they're at, and they help, they hurt, just what's going on, and it's just it is a big safety factor, and this is something here that's been needed for a long time, and like we've discussed before, I've been meeting with radio companies for the last 4 years, and the slurs seems to meet our needs, and if we tried it today, and if we buy it tomorrow, it's going to work just like it did today. If we don't have hopefully it does, but we know it works because we're using the same towers and the same radios that we use today. So it's it's just a real good system, and I was really impressed with it today.
Mr. Harris, will we have enough time to have that on the 19th, the meeting of the 19th? Do we have enough time to have that?
If we have everything, if we get all the information that we need on this state contract, we should be able to have it all packaged up and ready for you. That's the plan.
So Sheriff, I need you to get with this gentleman and y'all make sure that our office has got what we need.
We'll be 24/7, we'll take care of it, you sure will. You have everything you need, Mr. Harris, let me know what you do need, and it'll be done, tell you.
Yeah, we had already had the conversation regarding the state contract, so that's a big piece of this right now.
Well, I know a lot of times it gets bogged down on our end, though, and I just don't want it to, with everything that goes on, I mean, other things that's happened during the year, I certainly don't, I want to get this thing back front and center and let's move. So I appreciate the board's support. I think everybody feels the same. We're good to go on that. You have consensus on that, that's all you need?
Yes, sir.
Thank you, Lynn, thank you, Commissioner.
Thank y'all.
Thank you.
Moving on, item number 14, discuss with possible board action 20 acres of county-owned property on State Road 51 in Laurelville. Mr. Harris.
Mr. Chairman.
Mr. Harris, excuse me just one second. I would like to say, if anyone was here for anything else, you're not being disrespectful if you choose to leave. I don't know if there's anybody there. I mean, everybody's welcome to stay. If somebody needs to go, it's fine. A lot of times people, don't want to be disrespectful and get up and walk out, but with the times we're in, you're more than welcome. I mean, you're not disrespecting anybody, so.
I think the sheriff's gonna go out there and squeeze him.
He's gonna stay with him. Okay, I'm sorry, Mr. Harris, I didn't mean to interrupt you, but I just wanted to.
Mr. Chairman, Commissioners, we've got a piece of property out near Laurelville. No one today has told me that we need that piece of property. It was part of a swap. It was good for all of the parties involved at the time because it was part of an economic development improvement that occurred. We did a swap. There's a business out near the Catalyst site now that's up and running and doing a great job. But the county did not have an identified need for this piece of land. When we did the swap, it was really to facilitate this other project. I think I've spoken to each of you. You're familiar with the location of the property. It's 20 acres. My question is the board prepared to declare this piece of property surplus so that we can get it back on tax rolls and let somebody else own it?
Anybody?
Amen.
Sir?
Amen, what's up?
Okay.
My suggestion when I talked to Mr. Harris is release it, let's do something. If we don't have a long-term use, let's go ahead and sell it, be done with it.
I think everybody understands and knows right where it's at, and I'm perfectly in support of it, so you got consensus, sir?
Okay, the other thing that I would need, I want to go ahead and ask the board to give us, in fact, I'd like you to just vote on this if you don't mind. Let me go ahead and ask the board to vote to authorize us to advertise a request for proposals for real estate brokers to handle this piece of property for us. It's one of the approved mechanisms for disposing of surplus property. In fact, I'm going to ask you to go ahead and vote on the, and declare it a surplus as well.
Okay.
Does that need to be in two motions or one?
We need two motions on that.
Two motions.
Okay, I need someone to make a motion if they would, to declare it surplus.
So moved.
I have a motion by Commissioner White, a second by Commissioner Land. All in favor say aye. Aye. All opposed, same sign. Motion carries 4-0 on the surplus.
And I need a motion to authorize staff to advertise a request for proposals to try to select ultimately a broker.
I just have a question on that. Whenever we've never done this before, whenever we do that or request those, is that, are we, I guess that brokerage, whoever it may be locally, I'm sure, they'll give us like a suggested list price, what their commission will be, kind of like a whole
The
package. Is that
commission,
how that works?
no, the commission part would have to be disclosed in the proposal. When they send us a proposal, they're going to be responding to several basic criteria that we'll put in our advertisement, our specifications, if you will. So they'll answer those half a dozen criteria that we've requested, and one of those is that they're going to have to tell us what their commission would be, what percentage would be associated with that. The other information associated with list price and things of that nature would be handled on an individual basis for any number of properties we might utilize them for. Because what I would suggest is that, and a contract would have to come back to the board following the advertisement. The board would have to make the selection, it would have to be advertised. So you would participate in that, but then most of, this entity would then function much like an engineering consultant, where if we were to enter into an agreement for a year, we would issue a task order for each property that we're asking them to handle for us. That's what we do with engineers right now, because we have multiple projects to go work.
Can we just ask for local realtors?
No.
Okay.
In fact, let me just say, and it doesn't have anything to do with this particular issue, it has everything to do with what the state did. I don't remember how many years ago it was now, but a number of years back, there was a big push for local preference. And the legislature pretty much put a stop to that, said they're not going to have any more local preference. But if you think about it, I think that the local companies have the upper hand because they're closer and it's easier. I mean, if you were a company in Gainesville or Tallahassee trying to handle this and had to show a property, it'd be more difficult for you to travel here to do so. So I think local companies in this particular case are going to have the upper hand in this in response.
Yeah, I'm good with it. They can tell us what they're gonna charge us and what do they think it'll sell for, and we'll pick who we go with. Put it on the market.
We need that in form of a motion.
The authorization to advertise the request for proposal, yes.
So moved.
I have a motion by Commissioner Lamb.
Second.
Fight over second. Second
That'll
by,
be good.
second by Commissioner White. All in favor say aye.
Aye.
All opposed, same sign. Motion carries 4-0. Thank you, sir. We pulled item number 15 for the time being. Moving on to item number 16. Discuss with possible board action personnel issues related to Family Medical Leave Act. Mr. Harris.
Mr. Chairman, Commissioners, on rare occasions, we have an employee who doesn't qualify to file a request under the Family Medical Leave Act, and it typically has to do with the amount of time that they've been employed by the county. But and then there are other cases where we have an employee who's exceeded all of their sick leave and exhausted FMLA, and we have to come in and just ask the board to allow us to keep this employee on the books, even though we don't pay benefits when they've exceeded their time and their accrued sick leave. I'm making that request now. We've got an employee who has not been with us for a year, a very good employee. But this employee has been injured. It appears it's going to take some time for recovery. We'd like to have this employee back in the workforce. And they've made the request that we just keep them on the books for now because they don't qualify for FMLA since they had not been here for a year. So that's a request that I made.
Have any questions, comments from Mr. Harris?
Is this just a case-by-case basis? Is that what we're talking about here? Or is this general?
No, it's a case-by-case basis. And it's typically, I mean, it's going to be a case where it doesn't fit our typical rules and regulations, our handbook. We've done this in the past and it has served us well. I'll give you an example, and I'm not going to use any names, but we've had employees who have had to have extensive treatment for medical issues. They used up all their sick leave, they exhausted FMLA, and the board agreed to allow them to have more time to recover. And they're back in the workforce today and doing extremely well. We value our employees. It's tough out there finding good employees, and when you have them, you don't want to lose them. And we've historically tried to work with them and give them more time. Again, we don't pay their benefits in these cases, but they stay on the books, they don't lose their job. And when they're able to, they come back.
I mean, I'm good with it. I mean, it's case by case. It's you know.
Mike, we do the same thing. We've done it in the past.
I've done the same in mine.
Yeah.
Consensus is, everybody agrees? Consensus of the board. Mr. Harris. Item number 17, we discussed that on that the opening of the meeting. Do I have anyone from the public that's wishing to speak? If you are, just please state your name and address for the record. If you have any questions, comments that we could address.
Mr. Chairman, did you give us the additional item?
Number 18. Email, but I don't have it up here.
For the, this is Parks and Recreation, the renaming of the.
I don't have a paper in front of me, I'm sorry. I'm sorry.
Yeah, I did see the email.
Yes, I did. That's my fault. Our additional agenda item is approval of renewal agreement with First Federal Bank of Florida for naming of the First Federal Sportsplex. Requested action, approval and execution of a renewal agreement with First Federal Bank of Florida for the naming of the First Federal Sportsplex for $150,000 in a term of 10 years.
You said it all.
I've, Mr. Scott worked on that for a good while, getting that put together, and, I'm good with what he's done, following his lead. I have any questions, comments from the board? Wish to entertain?
Do we need a motion on that? Consent?
I'd like to have a motion, I think.
I'll make a motion.
I have a motion by Commissioner Hale,
Second.
second by Commissioner Land. All in favor say aye. Aye. All opposed, same sign. Motion carries 4-0. Thank you, gentlemen. Did I miss anything else, Mr. Harris?
No, sir.
Back to, at this time, did I have anyone from the public wishing to speak about anything? Seeing none, I will close public comment at this time. I have closing comments from the, Mr. Blatt.
Nothing today, sir.
Mr. Harris.
It is a tough time in our community. I never thought I'd see the day where almost every day I get a phone call with an employee who's either been exposed to this virus or just contracted the virus, or family members have. And unfortunately, I've heard of more deaths in the last 90 days than I ever dreamed that I would hear of, not only here, but in other locations as well. And at the same time that we're dealing with this virus, there are a lot of people who are dealing with another upper respiratory thing that's going around. It's very concerning to many people who have not had the virus yet, thinking that maybe they have that. So it's just a trying time for everyone, and I would just encourage everyone to pray hard and just believe that God's still in control, and have confidence that He can get you through this stuff. But it's tough. There are a lot of suffering people, a lot of suffering families right now. So I would just pray blessings on our community, and just tell everyone to be careful out there.
Thank you, Mr. Harris. Commissioner White.
I'd just like to thank you for having Mr. Waldron come in. That was very informative. I had a constituent call me and ask me about that very thing, and he answered everything I needed right there. So I was real glad he came in and did that. And that's all I have.
Thank you, sir. Commissioner Lane.
No, sir, I just agree that we've got trying times with COVID and everything going on. Just continue to pray for wellness of the world. Hopefully, I'm sure He will. God will see us through it. But this morning I witnessed, I was a first-hand witness on a traffic accident out on 90 West this morning. And I got to witness our first responders in work. I pulled over and did my civic duty to check on the ones involved and leave my information as a witness to actually what occurred. And our guys did in my opinion, top notch. I mean, start to finish. I mean, they were there cleaning it up, took care of everyone. Sheriff's Department, as well as EMT, fire rescue were there. It was. I hate to witness it, but it was. No one was. I think one got transported to the hospital here locally. Minor injuries, but our guys did a good job. I just want to commend them. Nice work.
Thank you, sir. Commissioner Hill.
Just kind of echoing what everyone else has said, I do want to mention a few names. These are, the COVID and the virus is affecting folks we probably don't even know. We understand that, but I just want to send a special prayer out to some friends, Eric Wood and his family, Nick Brown and his family, and obviously Mr. Flynn and his family as well. So I know some of those guys are Brown family's really got a hard road ahead of them right now, and we just want to lift them up in prayer.
Absolutely. I'm just kind of on the same lines as, I mean, really with what you're seeing and what you're seeing on TV is, we're gonna follow our course, we're gonna get a lot more cases here. It's gonna get back on us hard, and I ask everybody to please be vigilant, and, you know, I'm trying to do better about wearing a mask when I'm not in front of the camera where people can understand what I'm saying, but I'm trying to do better. I've been like a lot of folks. I mean, I don't like it. It's not something I enjoy wearing, but I think that the only way, and it's a help to, you know, at least maybe keeping someone else from getting it that you're coming in contact with, even if it's. So I would ask people to please, you know, use it more if at all possible. I want to do what we can where we don't get completely shut down again. I mean, that was brutal. That was brutal on this state. That was brutal on this county. I mean, obviously on the country, but I mean, when you just get locked up at home and you can't go to work and earn a living for your family, and your kids can't get to school. I mean, we're gonna see things 10, 20 years down the road from children not being able to be in school and get the education and the being with other kids. I mean, you're gonna see all these things that's gonna come to light at some point in time. That's why I hope the shorter that we can get this, the better. You know, because there's going to be effects. I mean, there's going to be studies done, and there's going to be effects to where it's going to take a toll. So I just really want to try to do everything we can to get through this. We got a lot of county folks out right now. If you kind of look at the room here, I mean, we've even sent out a request. I mean, obviously we have to have a public meeting for a record, but we have asked folks that doesn't absolutely need to be here to not come, just to try to do our part. Now, if anyone is welcome, if anyone from the public's welcome, you're always welcome, the door's open. But we understand in these times that, you know, whatever we can do to limit the amount of people that it takes to get the job done, that's what we're gonna try to do right now. I look forward to the days I kind of never thought I'd say this, but I look forward to the days when the building's full, you know.
That's right.
And everybody's safe. I really, really thinking hard and praying for my good friend, Commissioner Fleming. It hits home when you sit here and you look over, and I'm always looking over and waiting on him he'll say, Mr. Chairman, and I look over there, and that seat's and it's empty, and I mean, you know, it's just, I mean, you want them people to come back, and some of them, they don't get to.
That's right.
And I mean, that's just how serious this is. So, at this time, all I need is a motion to adjourn.
Make a motion.
Have a motion by Commissioner Hill,
Second.
second by Commissioner Land. All in favor say aye. Aye.